I think stem cells are going to allow doctors to treat patients for things that were in the past thought to be incurable. And I'm going to talk to you about some of those cases. And I'm certain that stem cell research will improve the health of people worldwide, and more importantly, will reduce healthcare costs. So I'm going to talk about repair stem cells. We hear about all the controversy over stem cells, embryonic stem cells in particular, fetal stem cells. And in both of those cases, you know, a life has to be taken. The cells that I'm going to talk about today are in our bodies. We all have stem cells. If you're sitting in that chair breathing, your stem cells are hard at work making sure that everything is repaired in your body. My original career was in tumor immunology, and I worked in a cancer research laboratory, and we made cancer vaccines for cancer patients. And we took their personalized cancer vaccines, so we made the vaccines out of their blood, their white blood cells that we would harvest from their veins. And the problem was we couldn't get enough cells. So then we started giving patients a medication that stimulates the release of stem cells from the bone marrow, and then we were able to harvest those stem cells, grow them up in the laboratory, and then convert them into a bigger, better vaccine. So that's how we got started. But the interesting thing we noted was that when we gave them the medication to stimulate the release of the stem cells, other things got better. People with knee problems, their knees got better. People with shoulder problems, their shoulders got better. We had a patient with a heart problem, the heart problem got better because the stem cells were released from the bone marrow and went to the areas where they were needed. So that's what really got me interested in stem cells for regenerative medicine. Why a nutritional supplement? Stem cells are only part of the story. Because we can give somebody stem cells and they home to the area of damaged tissue. But that's only part of it. They don't do all the repair. What they do is they send out signals and say, hey, rest of the stem cells, come on down. Let's fix it, right? And so one of the biggest benefits is they're recruiting other stem cells, and those other stem cells are coming from the bloodstream. So if you don't have enough circulating stem cells, then you're not going to get near the benefit. And that's what we found. Some people have fantastic responses. Some people have, you know, medium responses. Some people don't have any responses. We said, well, why is that? And then we started looking at the number of circulating stem cells, because they don't do any good if they're not available to do the repair. Our conclusion is the more circulating stem cells you have, the better the result in our clinic. So we wanted a supplement that we could give to our patients before they came, to get their cells circulating, so when we inject the stem cells, they go to the damaged area, release the signals, there are more repair cells to go there and help fix the problem. And then we also wanted a supplement that we could send them home with, so that, you know, those cells are still there secreting the messages. We want more and more stem cells circulating to repair the damage. So we started researching, well, what helps nourish and stimulate the stem cells in the bone marrow. And we looked at a whole bunch of natural compounds, and it's interesting that the snacks out there today, there were blueberries, there were blackberries, there were, in back here, there was some green tea, and there are a lot of natural things. And if you look in nature, really the most colorful things you can eat typically have the most benefit. The phytonutrients that are in them have the most benefit on the bone marrow and on protecting your stem cells, nourishing your stem cells, and stimulating your stem cells. So we looked at the literature, and then we individually tested all the different items that were candidates, all of them plant-based. We identified those candidates, and then we looked at different combinations. And the one thing that was surprising to us is that when we fermented those raw materials with the bacteria that's used to make sourdough bread sour, the effect went up about 5-fold. The effect of nourishing and stimulating the stem cells went up dramatically. And that's how we wound up with this product. Once we saw in the lab, well, we have this combination that really works great on stimulating the stem cells, let's see if it works in human beings. So we did clinical trials. And we found that this product profoundly nourished the stem cells in the bone marrow and significantly increased the number of circulating stem cells that are going to help our patients get better. So moving the stem cells from the bone marrow around the body where they would be available for repair. The name of this product comes from the Greek for movement, or to move, which is kine, and then of course STEM for stem cells, so the product name is StemKine. I'm going to bore you with some science. I'm going to look you in the eye and put you right to sleep. No, so I'm only going to talk about two different kinds of stem cells. One are the blood-forming stem cells, right? And they form the different blood cells in your body. And then the other ones are called EPCs, and what they do is maintain the vasculature. So these blood-forming cells, and they have fancy names because those are named for markers that are found on the cells so we can identify them, but they're meaningless. They're just a sequential number. They home to damaged tissue, right? When you break your leg, there's signals that are sent out to the bone marrow to say, hey, send us some help. So these things are mobilized from the bone marrow, and they go there, and they're the first responders, and then they send out secondary signals to recruit other stem cells to repair. In animal models, when you take a rat and you give them a stroke by clamping off one of the arteries going to the brain, if you inject some of these cells into the tail vein of the rat, they go right to the stroke, and they help repair the stroke. If you give a rat a heart attack, and then you inject the cells in the tail vein, they go right to the heart and help to repair the heart. If you tease up the liver or give them a chemical that damages their liver, give them the stem cells, they go right to the liver and help the liver. So they're very good at homing, they're very good at secreting factors that tell the rest of the body to come to the aid. Now, of course, if there aren't any circulating stem cells, what's going to happen? Not a lot, right? They're sending out the signal to nobody. They're screaming in the dark to an empty room. So EPCs, now these are the cells, they're also found in the bone marrow, they also home to damaged tissue, but their primary responsibility is to keep every blood vessel in your body nice, clean, and smooth. So without a balance, if you don't have a high enough level of these EPCs, you're going to be predisposed to every vascular disease you can think of, and the two major ones that kill more people than anybody else are heart attack and stroke. 1 out of 2.9 deaths in this country is from cardiovascular disease. What is the correlation of EPCs with health and disease? Well, we talked about cardiovascular disease. There's a huge study that's been ongoing. It's called the Framingham study, where thousands and thousands of people are enrolled, and they look at risk factors. And the higher the risk factor you have, the higher chance you have of dying of a heart attack or a stroke or having one of those events, okay? And in this study, which is in the New England Journal of Medicine, they measured the circulating levels of EPCs in patients, and they matched them up with their Framingham score. And guess what? The higher level the EPCs, the lower the score, the lower the risk they had for heart attack and stroke. And it was highly significant. Next slide is for all the guys in the room. This is erectile function. People with erectile dysfunction have a decreased level of EPCs. And if you categorize it by mild, see, people without erectile dysfunction, it would be 100. There's not a bar there. But people with mild erectile dysfunction have a decreased level of EPCs. With moderate, it's even worse. And severe, it's greatly depressed. And it makes sense because the vasculature, that goes to the penis, if there's not adequate vasculature, you're going to have erectile dysfunction. And not having enough EPCs can result in that. In summary, circulating CD34s and 133s, the blood-forming cells, are hugely important to health. They circulate throughout the body, and the more you have circulating, if you have an event, or even to prevent an event, the more that are circulating, the more repair that can go on because they home to damaged tissue and they recruit more stem cells to the damaged area. And EPCs, I think we've adequately covered that, again, they're very important for maintaining your vasculature, for cardiovascular support. So we have 2 published studies in the peer-reviewed literature on StemKine. The first one was a pilot study done on 6 people, and then the second was a bigger study done on 18 people, and this was the conclusion of the second study. To our knowledge, this is the first study demonstrating profound mobilization effect with possible clinical significance by a food supplement-based approach. And this was published about a year ago. Thank you.